The conflict we chose is recently on our unit we have had to block some rooms, so our ACPs have less of a workload. And when we're down from 3 ACPs, which is fully staffed, to 2 ACPs, they have some issues with still doing their AccuChecks, even though they still have the same amount of patients as they would on a regular day with a full floor. So that is the conflict we've been having. They feel like they are upset because they feel like it's more of a workload when in reality, with 34 patients and 3 ACPs, they have 12 patients, and with our decreased beds, when we have 2 ACPs, they still only have 12 patients. Steps for conflict management. The latent conflict is short staffing. So due to short staffing, that can cause these issues. The perceived conflict is just giving the reasoning behind it, and also asking the RNs to assist in doing the AccuChecks if needed, if the ACPs do get behind, which is expected on an everyday. If someone's behind, you help. The felt conflict is when the ACPs have now shown their emotions and they are upset that they feel like they are having to do extra work with for the amount of patients they have. Resolution of conflict. So the conflict management and the manifest conflict. The manifest conflict is taking the action to resolve the issue. So on our floor, we can ask the RNs, please assist the ACPs if the ACPs are getting behind, to make sure that they get their AccuChecks. We also have an assistant nurse manager available and a charge nurse without patients who can also help. Conflict management is trying to resolve this issue in a win-win situation for everybody, so that everyone's happy in the end. The easiest way, I believe, is to have the charge nurse help out and do them, even if it's just half of the AccuChecks and not all of them. Conflict aftermath is the positive or the negative feelings from the ACPs and the nurses and everyone on the floor regarding the situation and how it was resolved. It's not always positive, but that's our goal. Destructive techniques that would be used that you would want to avoid is ridicule, flattery, and helplessness. Flattery would be something as, oh, but you're such a good ACP, you'll be fine doing that. That's flattery. So part 2 is the delegation. So 5 rights of delegation. It's the right task to the right person, the right circumstance to be delegating it, the right person for the task, the right direction and communication, and the right level of supervision for the task.
Delegation errors. 3 common delegation errors that are commonly seen in the nursing profession would be under-delegating, over-delegating, and improper delegation. So under-delegating would be not using the resources that are around you, not using the people that are there to work with you in a proper way, trying to take the task on by yourself. Over-delegating would be when you're handing all your tasks out to other people instead of taking some responsibility for what needs to get done. It's an improper way to delegate your task. And then improper delegating would be where you were delegating tasks that were out of another scope of practice, like medicating delegation to assistant care provider instead of a nurse. Part 3, creating a healthy work environment. So what is a healthy work environment? A healthy work environment has been described as having policies, procedures, and processes clearly outlined to empower nurses to meet organizational goals, to achieve satisfaction in their jobs, and to retain nurses in the healthcare setting. What are the components of a healthy work environment? Components of a healthy work environment include true collaboration, meaningful recognition, authentic leadership, physical safety, appropriate staffing, genuine teamwork, and effective decision-making. Catherine and I's present work environment. Our present work environment is a healthy work environment that values teamwork and collaboration. It is a 34-bed medical surgical telemetry unit. Staffing is normally appropriate with 8 registered nurses and 3 assistant care providers. However, at times we have to work short. Because the teamwork is strong on the unit, even when we are short-staffed, their morale remains high and the work environment remains healthy. High value is placed on giving quality care to our patients. This keeps us going on our hard days and reminds us to give our best and help each other to reach all of our goals. And finally, leadership. What must an effective leader do to create a healthy work environment? To create a healthy work environment, an effective leader must ensure that their workers are happy and that their workers feel like they're doing meaningful work in their workplace. And that concludes our leadership presentation. Thank you.